Wondering if I'm live yet. See the circle? There we go. Awesome. Good Lord, man. I think I am live now. Thank goodness. Gosh, it took forever for the live stream to kick in. My phone wasn't working. The computer wasn't working. Kind of felt like the Facebook gods weren't happy about some stuff. I'm just probably getting overloaded as well lately. But anyways, hey, my name's Eric. I'm a physical therapist. I enjoy running a lot, and I enjoy getting out some good content to you guys. And sometimes this, does um, works for people that aren't running as well. But anyways, sorry I haven't been on last couple days. Um, it's been kind of a weird kind of couple days, and yesterday was pretty long. Weekend was kind of a little weird. Hope you guys are doing well at this time. I just want to give you guys some free stuff, just to make it so that you guys understand a little bit more maybe what's going on in the outside of your knee. I think I did this right. I'm hoping I did this right. Anyway, I'm just going to go ahead and get started. Um, yeah, so I've been trying to figure out over the weekend how I can maybe better serve you guys. Um, and especially at this time, you know, uh, maybe some of your PT department or physical therapist and people you work out with um, aren't there now, and you're having trouble getting some help with stuff that you need taken care of. So, um, if this is, I titled this, the knee series continued, lateral knee pain while you still might have it, um, and maybe some other stuff. As I keep doing some content and try to get good stuff out to you guys, um, I'm learning more and more about what I could offer you guys. And most of the time, it seems to be that, getting out of pain and staying out of pain and being able to run or walk, or do whatever you want to do without pain tends to be at the top level of what most people want. So I decided to do this knee series and try to hit up the most common things that I run into in the clinic, and maybe some other stuff that may not be as common but still pretty important to some of you guys. So um, anyway, if you have any questions, hey Jeep, uh, thanks for hopping on, man. Appreciate your time. Um, Thanks for letting me know you're even there. Sometimes I don't know anyone is on. This is on my wife's computer, and I'm just not quite sure what's going on because I can't do it on my phone. It's easier on my phone, and I think you guys get better quality on the other end. But anyways, I'm trying to figure out how to serve you guys. Um, help me figure that out. Uh, yeah, the when it comes to nutrition or coaching or pain and stuff like that. Um, I've been reaching out to some nutrition experts, and hopefully, hey Carrie, good to see you. Uh, love the stuff that you're that you're that you're posting is fun, and I enjoy resending it out. Christine, oh my gosh, blast from the past. Good to see you. Hope you and your family's doing well. Say hey to Joe for me. Um, Thanks for saying that, because sometimes, I still don't know if I'm reaching anybody. So thanks, Christine. Um, but yeah, so I've been reaching out to some nutrition experts, primarily endurance athlete kind of stuff. And I'm wondering what else you guys would like to hear about or hear from. So with that, we'll get started. Um, my Facebook group, Running Motivation and Training League, just started it not too long ago. I'm trying to get some valuable content out to you guys so that we can discuss stuff and some running stuff and just make it so that people can enjoy their run and maybe not be in pain and maybe get out of pain pretty fast so that they can train and hit their PRs and just maybe simply just enjoy life. Um, yeah, so lateral knee pain, pain on the outside of your knee. Why you still might have it, and why it might be still hanging around. So anyway, let me get myself situated here. Okay, so anyway, I think I was talking about medial knee pain on the inside of your knee. Today, I'm going to touch a little bit on lateral knee pain. Hopefully you guys can hear me. I think you can. But anyways, the outside of my leg. When most people have pain on the outside of their leg, particularly around the knee, they think about, your IT band, iliotibial band, and it's actually a pretty strong, thick band of tendon that comes off of your hip muscles that don't go down very far, about to right here, but then influence your knee, and they actually create this pretty strong, relatively thick container on the outside of your knee. That's why when you tighten up your quads, that side is super tight. On the inside, maybe a little bit less tight, even though it's very muscular still on the inside, possibly for you guys. But on the outside, that's a container. That's your IT band. That thing that pops out right there, IT band. Anyways, and it tends to get a lot of fanfare in the running community, especially because when we have lateral thigh and lateral knee pain, well, what do? We foam roll it, right? Sometimes multiple times a day, sometimes every other hour, particularly maybe before, but and certainly after our runs. But it tends to hang around sometimes, and at that point, really, I don't believe it's IT band pain as much. I start thinking of, well, your sciatic nerve. I keep saying it, it's about the size of your thumb. It's not small. Comes down around the back of your hip, down the back of your thigh. Then right around here, generally, it splits off. Becomes your tibial nerve as it goes down the back of your calf. That also splits on the outside of your knee, right here, becomes this thing called common peroneal nerve, and then goes down the front of your lower leg and outside your lower leg. Anyway, the splitting happens right around the outside and maybe just underneath the outside of your knee, which is where a lot of people get that IT band, maybe friction feeling of pain right on the outside, right there. Um, and if it's maybe a more of a true IT band, I say more of a true. Sometimes it's a combination of maybe this nerve thing and the IT band. Normally it'll be super tight and sharp pain right on the outside of your knee, right there. And sometimes it'll be at its worst at about maybe 30 degrees of knee flexion around there. Um, Not all the time, but sometimes. Anyway, the stuff that if it tends to be right here, maybe it is IT band stuff, but often enough I see the nervous system in this thing. If you find yourself rolling on your IT band a lot and you find your IT band, just really tight, and it's been for months, if not maybe even years. Um, you know, sometimes I just that to me as a clinician, as I keep looking at this stuff, to me it tends to be at least a very strong possibility that it's the nervous system as well, because right here it starts to split off into two different nerves as it goes down your lower leg. Um, and this might be one reason why this outside, and you can get caught up with this nerve pain all the way up and down your leg. Um, a lot of times it ends up being something that shows itself up if you sit down for your job often, or if you've had some knee pain in the past or knee surgery in the past, and this thing on the outside just tends not to go away. Um, and there can be some other things too. Maybe you had a really bad ankle injury, and that can influence the outside of your knee. And sometimes what people do, if you go to certain PTs, they might try to manipulate the outside that we'll call your fibula, your fibular head, as it is a little bit, it's kind of mobile right there. And sometimes some PTs will just pop that thing, meaning that they'll manipulate it. They'll put maybe their knuckle behind there and they'll force flexion, and it tends to relax this area. And that's generally just what a crack in your back does. If you have someone crack your back, it just feels good. You can tend to relax, right, for a second or two or three or longer. It just feels good. It tends to relax everything. And just about everywhere you can get a cavitation, um, sometimes that ends up just quieting the muscles, quieting the nervous system a little bit more, so there's not as much nerve generated pain or any other kind of generated pain. Um, but sometimes it ends up being the nerves. Again, particularly if you roll your IT band all the time. So, just as something that I do, I talk about nerve pain a lot because nobody else does, and I see it being a problem often. Okay, can't believe it's already been 11 minutes. Anyway, so if you got my other series, medial knee pain, I use this stuff a lot. This is your CVS brand tape. Most people buy maybe some rock tape, or Kinesio tape is the one that got all the traction back in the day, particularly in the 90s and after 2000. Then everybody started getting in on it when the patent ran out, but for good reason. A good design, a really good design actually, but I don't like computers. I like my phone better. Anyway, so often enough, if the nerve is kind of generating some of the pain here, I'll go right around the fibular head. That bone sticks out on me more than most people because I'm uh, a little bow-legged. Anyways, just put about maybe 75-ish% stretch on that. And depending on how bad it is, I might put 2 layers on. And overlap it maybe halfway. And there you go. Now, the funny thing is, now this is IT band stuff, right? And sometimes when you have nerve pain generated as it splits here, sometimes if you do exactly what I did on the outside, but you do it to the back of the leg here, just behind that tendon there, on your biceps femoris, just on the inside of it, just on the inside of it, not on the outside, but on the inside underneath. If you tape right here and kind of maybe guide it laterally a little bit, and your pain goes away that's on the outside your knee, chances are that could be the nervous system generating the pain. And this does happen to a lot of people that end up sitting for their job, if they travel a lot or if they sit down often. And the stuff that, I mean, just if it tends to not go away, and you've been rolling on this thing for like ages, weeks and months, and it still kind of hangs out every now and then and goes down the outside your lower leg, You know, sometimes just doing a little tape job along the IT band itself will make it feel better. Again, maybe 75% stretched out, maybe tacked down, maybe the first like maybe inch and a half, um, and just lay it down as you go up the outside of your lower leg. Um, and as you do that, uh, that will tend to make some of this stuff go away. And some people run with it. It can last 2 or 3 days. You dab it or pat it dry when you get out of the shower or bath. It can last that long. Um, if you if it starts to itch, take it off. You know, your skin, the pH of skin, pH of adhesive isn't quite that perfect of a mesh. So, you know, it might not be that great for you. And sometimes, funny enough, milk of magnesia helps. You put a little layer on, you let it chalk up and dry up, and if this tape really does help, put it on after it chalks up, and sure enough, you're going to end up feeling better. Um, Really, whether it's IT band stuff or if it's nerve stuff, but the stuff that hangs around a lot, um, and just won't go away, and it's been months, you've been rolling this thing on the foam roll on the outside, it just won't go away. Sometimes that's the nerve. Not all the time, but or not all the time, 100% of the pain being generated, but often enough, if you're rolling on this thing and you're doing everything everyone's telling you to do, um, sometimes it's the sciatic nerve kind of just involving this whole area, and the sciatic nerve is so big. It takes up so much area. So even when it's just a little bit irritated, you can have what might seem like a hamstring problem, or what might seem like IT band stuff. You know, hip stuff, knee stuff, you know, lower leg stuff, ankle, and even top of the foot stuff. And maybe it's helped along the way with your back. Maybe your back's not quite perfect. You know, if you've dealt with hip issues, then all of a sudden, you know, you have lateral knee stuff as well. Sometimes it ends up being medial knee, but lateral knee pain as well. Sometimes it's your sciatic nerve. And yeah, I just thought I'd give you guys a little tip on this. Maybe help you out, kind of create a strategy so that you can deal with this and maybe not feel like you have to deal, you know, with it for the rest of your life. And still enjoy running and not worry about, um, you know, your symptoms staying with you. But anyway, hope this helps. I wanted to kind of not make it real long, but just I know that there's a lot of stuff going on, and thought I'd just hop in, give you guys a little bit of a, you know, assistance with maybe some lateral knee pain, and we'll do some other stuff maybe tomorrow as well, considering you know, concerning the outside, you know, lateral knee, and then maybe we'll go to the back of the knee, and then we'll do the front of the knee, which ends up, you know, being kind of an issue. But yeah, so anyway, hope this helps. Uh, Take care, you guys, and praying for you. There's a lot going on. Um, yeah, there's a lot going on. You guys probably have a whole lot better stuff to do than to watch me, but I'm hoping to give you guys some good content for free, and just, you know, make life maybe a little bit easier for you if it can get you out of some knee pain, or any other kind of, you know, lower leg or leg pain. Then I'd like to do that. So maybe make your, you know, life a little bit, you know, less stressful, maybe a little less painful, and some of us aren't able to get to you know, the PT. You know, referrals are decreasing because doctors are decreasing their hours, and so um, you know, just like to just share it out with you guys. And if you want me to share out anything else regarding, you know, back, hip, leg, knee stuff, foot and ankle stuff, then, you know, let me know. You know, comment on this little thread here. Started with Christine. Thanks so much. Love you, sister. You're awesome. Give my love to your husband. He's awesome. Miss him. I wish I was back in Cali more often. It'd be great to see you guys too. So, but yeah, take care, guys. Have a great night. And yeah, we'll talk again soon. Tomorrow will be about, probably we'll stick with the lateral, the outside of the knee pain, and talk about how maybe the foot influences your the outside of your knee pain as well. So take care, and God bless you guys.